Hi, you don't know who I am, but I'm Tony Lasano.
And I'm Amy Zanglin.
And we're from the hit show Nude Hippo, Your Chicago Show.
Stay tuned. Tape with Rabbi Doug is next.
It is.
We're gonna see Rabbi Doug. We're gonna see Rabbi Doug. We're gonna see Rabbi Doug on your TV tonight.
But Daddy, I want to watch Monday Night Football.
Forget about Monday Night Football. There's no other thing we're gonna watch on Monday but Rabbi Doug. Yeah, Rabbi Doug on TV tonight. We're gonna see Rabbi Doug. Oh, everybody talk about Doug.
Shalom and welcome to Taped with Rabbi Doug. Glad you could be with us today. My guest today is Dr. Michael Epstein. Welcome to the show.
Thank you. Good to be here.
Dr. Epstein is a plastic surgeon, and he is not just a plastic surgeon, but an expert in aesthetic plastic surgery. Well known, he's been on the Maury Povich Show. He's been on Oprah. You might have seen him on late night TV, as if you're a cable TV viewer. And he is someone who loves what he does. You always wanted to be a doctor, didn't you?
Just about my whole life. I think it was drilled into me at an early age from my Jewish mother.
When someone wants to be a doctor, how do you end up going into plastic surgery? Obviously, you got to go through medical school. You got to decide what field you're going to go into. A lot of people say, well, if I go into psychiatry, I don't have so much malpractice with my hands. My hands don't have to be so perfect as a surgeon. Or some people say, I love children, so I'll become a pediatrician and so on. What makes someone want to go into plastic surgery and do cosmetic plastic surgery? Where did that all come from in your life?
Well, it doesn't happen just like overnight, like poof, you decide to be a plastic surgeon. As I stated earlier, first it was I wanted to be a physician, and throughout the process, the long educational process, it went from wanting to be a physician to wanting to be a surgeon, or learning that I was probably leaning in that direction when you look at the fields of surgery versus medical fields. And then I met up with the chief of plastic surgery at my medical school,
which was
Marty Robson at Wayne State University at the Detroit Medical Center, and he kind of took me under his wing. I actually volunteered to do a talk at the Surgery Grand Rounds on a historical presentation on the father of plastic surgery. And it just sort of started from there. It got me interested in the field.
Father of plastic surgery. Who might that be, and when did plastic surgery first start?
Well, actually, the father is a guy, an Italian surgeon named Tagliacozzi, and the field started in many different. The actual field of plastic surgery actually probably started somewhere after World War II as a spin-off from surgery, but the actual performance of reconstructive procedures occurred. Even there's documentation of surgery, plastic surgical procedures being performed BC.
Really, I was going to ask
by
ancient
Indian
cultures.
Yeah, by Indian plastic surgeons.
How interesting! How interesting. Did plastic surgery start just as reconstructive, or was there cosmetic surgery at the very beginning that it became popular? Let's say.
I would say that the field of plastic surgery really started more as a reconstructive, with reconstructive goals. But we, as plastic surgeons, always all of the whether it be aesthetic surgery, cosmetic surgery, or surgery that's more on the reconstructive end, the two go hand in hand. We always have this sort of motto that form should always follow function, and you want things to look the part and also act the part. And so even when I'm doing aesthetic plastic surgery, I'm always concerned about the function of the certain body part that I'm working on.
Sure. Now, plastic surgery is so interesting. People say that the two steadiest hands in a surgeon's life are the surgeon that does a heart bypass and the surgeon that does plastic surgery. Would you say that, were you someone who was very coordinated with your hands? Did you build models when you were younger and things like that? Or was this really a learned art to have that steady hand and that perfection in plastic surgery? Were you an artist? interesting questions I know to ask.
No, sure. I've always had an interest in the arts and art forms, and nothing, throughout my early learning years that I didn't really take special art classes or anything like that, but always had an appreciation for beauty. And as far as the hands go, I think those were just passed on to me through. There's a couple of second cousins that were surgeons, and my father, even though he's a teacher, he always had pretty good hands. So.
Very nice, very nice. Okay, let me jump into the big question. What is the toughest surgery you've ever done?
Boy, oh boy. The toughest surgery.
The one you could be most proud of because it was the toughest and it came out the way it should have.
But that's a really.
I said I was going to jump to the tough one.
I would have to say probably the absolute toughest operation that I ever did was probably in my residency, and I was working at the Veterans Hospital in the Detroit area, and I reconstructed a gentleman's complete lower jaw by using his fibula, which is the small bone in the leg, and some soft tissue that was taken there, and under the microscope connected that to blood vessels in his neck.
Was he someone who was in an accident or something of this?
No, it was from he had a resection from cancer.
From cancer.
Yes.
How
and that was rewarding and interesting all in one, and successful, I might add. So.
In the field right now, probably the most rewarding changes that you see in people is in burn victims. You see burn victims that the before they looked so deformed, and after you almost can't tell sometimes that they were in a fire at all. Is there a lot of progress in reconstructive surgery for burn victims that has changed in the last number of years?
I think there's a couple things that have evolved. The actual non-surgical treatment of burns with the art form of compression dressings and doing that early on to keep the scars soft. But also microsurgery is probably the biggest advance in that field, because you're able to really take off all of the burn tissue in a given area if it has a known blood supply, and if there's donor tissue that has also a known circulation, it can be transferred. The latest. I guess the latest big news in the reconstructive realm of plastic surgery is really with the face transplants, and that I think one of those patients was a burn victim, I believe, and this has been done in Europe. So
in the newspaper all the time, and following those stories.
Right.
Very interesting. Well, you brought some photos and some things that you've done. Tell me, what do you usually do? Is it the famous nose job, probably the most popular cosmetic surgery, or is it removing scar tissue or breast augmentation? What is the most popular or the most requested cosmetic surgery these days?
Well, that's a good question. I do plastic surgery on both the head and body, and my practice pretty much follows the data and the numbers that are given, that are also seen across the country. And the number 1 and 2 procedures are still liposuction and breast enhancement or breast augmentation surgery. The third most common thing I do are abdominoplasties. And then rhinoplasties are probably the fourth most common.
What are
thing.
rhinoplasties?
Nose reshaping surgery.
Nose reshaping.
Yes.
Tell me. You brought up liposuction, that you do a lot of that. Now, liposuction, obviously, for someone who's very heavy, could be a very that step towards losing a lot of weight and going on that diet, that first step and so on and so forth, as the stomach stapling and tying is very popular nowadays. Is liposuction, it seems to me, as a layman, liposuction seems to be that it must be a very dangerous surgery, maybe more dangerous than any other cosmetic surgery that people have. Are there some times that you say, no, we can't do this with you, it's too dangerous for you? Where do you draw the line and how do you decide?
I love the question, Rabbi, because I get this all the time in the office, and liposuction is one of the most misunderstood operations, even though it is probably the most popular.
My wife's big joke, each time we've had a child, she says, I'm getting liposuction, I'm not waiting. And of course, she's just joking, but, it's a big joke. But it seems to me it must be very dangerous.
It's not. Actually, it is probably, of the surgical procedures I do, and the numbers bear this out, it's really one of the safest.
Really?
Again, that's surgery that's done on the right person by the right person, and the complication rate is extremely low. It's just that because it's so common, you hear about some fatalities and major catastrophes throughout the world. One or two or three of them may
stand
occur
out
throughout. Exactly, and typically, as you do a little research, it was done either on the wrong person or by the wrong person, and that's because not just plastic surgeons are doing plastic surgery. That's why you have to do your research and you have to find out, make sure that you are a good candidate for liposuction and you're going to a surgeon that is well versed in not just liposuction but some alternative surgery or alternative recourse.
Interesting. Do you enjoy what you do? I mean, are you happy you went into plastic surgery?
I love it. I love it. It's every day I go to the office. What could be better? I mean, I'm getting paid for doing something I absolutely love to do.
And you see, it's just like an artist or a TV producer who puts together a TV show and it comes out good. You see the product of what you did, and you must get great nachas from it. You have a lot of self-satisfaction that you completed and did a good job for someone.
Absolutely, and it's not just the physical beauty that I get to see at the end result. It's also what it does to that person when they come in 3 or 4 months down the road and they just got this big smile on their face because they're, this is typically the average plastic surgery patient is somebody that's been bothered or tormented by a particular body or facial feature, and I'm able to correct it.
Now, Jewish law says that
now you're going to throw me a curveball.
Aesthetic surgery just for cosmetic purposes is forbidden. It's forbidden to mutilate your skin, just like it's forbidden by Jewish law to put a tattoo on your skin. But if it has a medical positive effect, then you're allowed to do it. For example, someone who may have a bad curvature in their nose, and they also have a breathing problem of some sort, the cosmetic surgery will not only make them look better, but it will also help them breathe better. It's certainly allowed by Jewish law. Have you ever had somebody come to you and said, I have to ask my rabbi or my clergyman whether I'm allowed to do this or not?
I haven't had that happen yet.
You haven't had that happen yet.
But I can see how that could
come up.
Certainly come up.
All right.
Yes.
Now, you are very well known. You're famous. So many people have seen you on Oprah, which is such a popular show. Have people, flown in TV stars, movie stars, and people come in to see Dr. Michael Epstein because I want him to be the one to do my surgery?
Not directly movie stars, but certainly I've had family members and, definitely people that don't want to necessarily be known that they're having, yes.
Like to have it in L.A. right in front of everyone. Correct. And stuff like that. Very nice. Very nice. Well, you brought some pictures with you, and I think that we want to say, can you describe what you brought with you and what we're going to be looking at, if you could?
Well, when you asked me to be on the show, I didn't, plastic surgery means so many different things, and even aesthetic plastic surgery, we could talk, for hours. So I tried to pick a couple different topics to zero in on. And I thought maybe a good place to start was with fat, and because I find in my practice, not only am I taking fat out and reshaping bodies, but I'm also taking high-quality fat cells and reshaping faces or rejuvenating faces with it. More and more, that's been sort of an in vogue and very worthwhile area of facial rejuvenation.
Let me ask just a quick question. So just like someone who has heart surgery, the veins or arteries or whatever they do, they take them out of your arms or your legs and use them for that surgery. You're taking fat out of one part of the body and replacing it in another when you do the surgery?
That's right. That's right. And that by itself has been done for a while, but it's the actual art form of actually taking the cells and transferring the high-quality cells in a different fashion has made it much more successful over the last several years, and made us a better facial rejuvenator. Okay, the three things that occur with facial aging are obviously the gravitational effects that occur that everybody knows about, the loss of elasticity in our soft tissues and skin, and then the one thing that we've sort of left out up until about 4 or 5 years ago was volume loss. You know, we actually shrink up in the face a little bit, and so now we can actually add that volume back along with doing the anti-gravity work and rejuvenating the skin a little bit.
Before you do that, are you a Botox advocate?
Oh, absolutely.
Yeah.
Absolutely. Even though my practice is mostly surgical, we have a lot of non-surgical services in the office, and it's a great. Botox is a wonderful tool to stave off the aging process, and if you do it early and relatively often, you will actually prevent yourself from having lines increasing.
Great. Show us what we have.
What we have here is a relatively young lady. If you see up here in a couple of every other picture is actually her before surgery and then her after, and one of the things that she's bothered by, and this was just really around the eyes and the upper cheeks. You can see that she's really hollow, okay, in these pictures of the befores, and actually has dark circles. And the dark circles are a common question that people come to me about, and that's really caused by loss of soft tissue, loss of fat. And so you're seeing skin right on the muscle, okay? And the muscle is what's darkens the skin. And so what we've done is rejuvenated the skin with a deep chemical peel and added fat back in the upper cheek and underneath the eye.
The cheeks almost look like model cheeks after you've done that, because the high cheekbones, that look is there after you've done that, and certainly isn't there before.
That's right. And you can see it actually creates. If you look at from a side, you can see a much more defined, like OG curve, here, which is a sign of youth, okay, on the side of her cheek, and this can be done, time and time again. I mean, again, this was just somebody that just had her eyelids done. This was not a full facelift. She did have a chemical peel, and we did fat grafting, and in addition to that, I took off some extra skin and fat from the upper eyelids, and so here she was beforehand. And here she is after. And again, you can see, before she looks hollow underneath here, and then we just fill up the space, and that's what a youthful cherub look is. You don't really see the difference between where the eyelid begins and the cheek starts until you get older.
We've all seen those makeover shows on cable and stuff where they're black and blue for weeks and they come out okay at the end. What is the healing process in that black and blue time? How long does that really last after something like that cheek and eye surgery? Under the eye surgery, I should say.
I'm glad you asked me that, because actually, with facelifting surgery, the bruising time really isn't that great anymore. It seems like the amount of bruising and swelling goes down relatively quickly, and you can return to a normal life soon. You can get out there again, be out in the open. With fat grafting, though, all bets are off, because there is a lot of needle trauma that's being done in the operating room, and you can be quite bruised and swollen, and it might last 2 to 3 weeks. So that if there is a downside, it would be that it is a longer recovery process. Okay?
What is the pain factor in doing a surgery like this? Do you use local anesthetics? Do you use no anesthetics? Do you put someone to sleep? Are they awake during it? The quasi sleep? Where are you when you do this face surgery on these people? What kind of state are they in?
Well, I'm fortunate. I have a new state-of-the-art facility at my office or on premises, and I have superb anesthesiologists. They're doctors that give anesthesia. And for this type of surgery that I've just been showing you, these patients go to sleep for that. I mean, they're sleeping, but they're breathing on their own the entire time. And it's a little bit deeper than what you call a twilight, but it's not so deep that they're connected to a ventilator and being where a machine is breathing for them. And they can do this because our anesthesiologists actually monitor brainwaves throughout the operation and know what the level of consciousness is.
I don't want to go into great detail, but I have a good friend who I taught his children, and he was a very prominent obstetrician here in the North Shore. And he picked up and moved to Wisconsin because the malpractice insurance just went sky high in Illinois for obstetricians, and he's doing very well there. Not as happy being he has, as a matter of fact, just going there were my students. His children, he waited till they were in high school because he wanted to make sure that they all had their bar and bat mitzvah before they left, and hopefully that they would be going away to college and being among Jewish kids, because he's in a town now where there are almost no Jews, and wanted his children to be in a Jewish community. But you yourself and people in your field, is it the same problem with malpractice insurance in Illinois for a plastic surgeon?
Well, the malpractice insurance issue is across the board. It's a problem. The problem with physicians that don't have the luxury of still being truly fee-for-service, you're getting hit at the other end too. And that's
like if you're an HMO or something like that, and there's
an HMO or even traditional insurance companies, Blue Cross, they're actually ratcheting down their fees. So the cost of running a medical practice has gone up significantly because of malpractice rates and because it costs more to have employees and turn on the lights, and they're getting paid less and less and less every year. By the insurance company, by Medicare, and Medicare pretty much dictates, to the other insurance companies what they're going to be paying. So secondhand, us as plastic surgeons are sort of getting hit, because what's happening is more and more people are adding cosmetic surgery or plastic surgery to their practice to augment their income. So that's how we're getting hit. But the malpractice problem is across the board.
Now, do people come to you as a plastic surgeon for reconstructive surgery also? I was in an accident. I know that your main thing is doing cosmetic surgery, but I was in an accident and my God forbid, my hand was deformed, my arm was deformed, my chin was deformed. Are you still doing surgeries like that? Are people coming to you for things like that, or is that other people who specialize in those things?
Occasionally, it's the type of thing where, when I first started in practice, I was doing a lot of that, hand surgery and major reconstructive operations, microsurgery. When I decided to push my practice into just doing cosmetic surgery or aesthetic surgery, I pretty much wanted to devote my attention to that, because I just felt it wasn't fair to a patient that might be paying
Whatever
and a lot of money to have their facelift done, and the night before I was up at in the emergency room taking care of somebody whose hand got injured or face got crunched, and so and the further away you get away from doing that type of work, the more I find myself passing it off to people that are doing that on a regular basis. It's just fair. It's just the way to do it.
I understand. You as a plastic surgeon see obviously a lot of patients in the field that you're doing it with. Most of them are not able to cover aesthetic surgery by insurance. Is that correct? People actually pay out of their pockets usually? Because I presume that most insurances wouldn't cover it unless it had a medical necessity.
That's correct. There are very few things that that I do where insurance is paying for these things now. Occasionally, some of the rhinoplasty nose reshaping surgery can be covered if they're having some breathing difficulties. Occasionally, a breast reduction can be covered by insurance if it's large enough and the insurance companies are willing to pay for it.
Right. Okay. What about liposuction? What about people who are overweight? Is liposuction ever covered as far as someone because they're at a dangerous weight? You know, they'd be a heart attack candidate if they didn't lose weight, or do they have to go into the traditional surgeries to do something about that?
Yeah. No. That hasn't happened yet, and I don't think you're going to ever see that happen. First of all, I don't think it really works that way, where liposuction would actually make you a healthier person. It's truly taking care of the external fat, and you really, ideally, you want to treat people with disproportionate problems, not suction somebody that's obese. So most of those patients are taking care of their weight loss either the traditional way with diet and exercise, or as you had mentioned, with the gastric bypass or intestinal bypass operations.
So interesting. I mean, we could talk for hours. I got to tell you, so many people ask questions about cosmetic surgery and about plastic surgery, and nobody really knows much about it. You've answered so many questions. Do you think that there is a future of advance in the field? And do you take regular, go to regular conventions and take regular meetings with other plastic surgeons to discuss growing new procedures in the field?
Yes, all the time. I am, constantly educating myself with journals. I go to meetings probably 3-4 times a year, and it's funny because one of my other medical colleagues saw that I was going to a meeting and says, "You actually go to the meetings?" I said, "Yeah, I enjoy going to the meetings, and I learn a lot, from the give and take of information." Where I think a lot of the physicians find so much of it boring or trite. So I'm constantly updating myself, and you kind of have to in our field. Boy, I mean, the changes come so fast and furious, and you have to weed out what's really good for the patients and what's not really good at all.
Great. Well, I want to wish you much success in your career, Dr. Michael Epstein.
Thank you.
It's been a pleasure to have you on the show. I would love to have you on again in the future to talk more about other procedures in plastic surgery, because the time has just run by, and I want to thank you so much for coming. And Oprah, watch out, he's been on my show now. I want to thank you all for being with us too. Remember, check out our website, www.tvrabbi.com. If you have an email or a question for Dr. Epstein, I'll be happy to forward it on to him at info@tvrabbi.com is where you can email us. I want to once again thank my guest, Dr. Michael Epstein, and I want to thank all of you for being with us. Hope to see you next time right here on Taped with Rabbi Doug. Shalom.
Yeah, I'm talking about Rabbi Doug. Talking about Rabbi Doug. Talking about Rabbi Doug on your TV show. Well, he's the rabbi for me. Anytime you need, you're gonna get married or you're gonna die. Gonna see Rabbi Doug. Gonna see Rabbi Doug. Gonna see Rabbi Doug. Gonna see Rabbi Doug.